Okay, welcome everybody. Today is Therapy Thursday. It is July 28th, 2022. And my name is Evan Adler. I am a physical therapist here at UNC Health, based at the Northwest Cary Wellness Center here in Cary, North Carolina. Very happy to welcome you to Therapy Thursday. Therapy Thursday is our online informational series brought to you by Rehab Services and the um, Community Engagement Committee. Trying to give back to the community, really reach out and interact, give information, help educate the community about physical therapy and other therapy services, and how we can help you, achieve your goals and get back to the things that you want to be doing. You may have found out about us through emails, through our wellness center, or some e-blasts or social media. I do want to remind everybody that you can find more events like this on our Facebook page for UNC Therapy Services. And if you missed any part of today, or you'd like to go back and see other episodes of Therapy Thursday, I please invite you to do so. We have recorded them and posted them on our YouTube channel, and I'm going to put those links in our chat shortly here, so you'll be able to find them there. During the course of our talk today, I will be kind of monitoring our chat, so please do use the chat function if you wish, if you have questions during the presentation, and I will kind of help Jolene kind of go through those. But we're going to try to save the questions for the end. We'll save a little bit of time there and answer any questions that you may have. So, without further ado, I would like to welcome you to Therapy Thursday and introduce our presenter, Jolene Hernandez, who's going to give us an unbelievable talk about aquatic exercise. So, Jolene, take it away.
Thank you, Evan. Thanks everyone for joining us today. If you're in North Carolina with me, it is hot outside and it's about time to get our feet a little wet and talk about aquatic exercise pretty generally today. It's just an introduction and a little bit of a focus on orthopedics and our lower body exercises. But first, a little bit about the person behind the screen. Again, my name is Jolene. I'm a physical therapist here at UNC. I primarily work in the ambulatory care center, which is hospital-based. And then a couple times per week, I get to have fun over here at the wellness center in the Meadowmont pool. And I serve primarily orthopedic patients in the water of all ages, pre-teens to our adults. And I currently serve as our UNC Aquatics Committee Chair with a wonderful group of therapists here. And far before physical therapy, I grew up in Eastern North Carolina. Wake Forest is my undergrad, so I always have to give a little shout out, go Deeks. So our top 4 objectives today, we want to discuss why water? What's the benefit of getting in the water? Number 2, what do we do in aquatic physical therapy in particular? What makes it different? And 3, it's very important to talk about safety, right? What is indicated and what's not indicated to get in the water? What makes you unsafe? And then last but not least, we're going to check out some videos of common lower body exercises that I find very beneficial for my patients with low back pain, hip pain, knee pain, ankles, kind of those general topics. So, properties of water. Before we talk about the benefits, we have to understand what is unique about the water that is allowing us to have these benefits. The star of the show is by far buoyancy. That's that property that lets you float, right? It gives you that nice offloading feeling when you're in the water. Number 2 is our hydrostatic pressure. That's that force, that pressure that you feel from the water. There's more at your feet and a little less as you go up. It's really good for edema management and fluid and kind of moving things through your body. Viscosity, drag, turbulence. all pretty similar. They provide resistance to you as you're moving in the water. So when you're walking back and forth and you turn around real quick and you feel like you're about to be knocked off, those are those properties that are giving you force back into your body. Thermal effects, if you're in a warm water therapy pool, you know how amazing this feels, kind of like hot tubs or hot showers. That warm water has so many good pain benefits. And then the last one is refraction. So with this, I'm thinking about the way that light hits the water and can distort our view of our feet in the water, but then also just the light bouncing off in front of us. Really good for our folks that have vestibular rehab needs. There's lots of new research coming out to support vestibular rehab in the pool, which is pretty exciting. But I promised to keep it an intro, so let's carry on. The benefits, decrease joint load. So buoyancy, number one benefit that we get from buoyancy is decreased joint load. When we look at this picture that's off on your right, it's a graph of how much the water is offloading your joints at different depths of water. So if we look right there in the middle at your hip depth, maybe this is 3 to 4 feet of water, depending on how tall you are. This is 50% of your body weight offloaded, which can feel wonderful. But this is only if you're just standing. So as soon as you start moving in the water, that number can change. So if we say, for example, we are at chest depth water and we're just standing, your joints below the water surface are 70% offloaded in comparison to standing on land. But as soon as you start moving, like if you're slow walking forwards in the water, that 70% goes down. You have more joint force going through your body, which is beneficial in many cases. So just know that when you're moving in the water, it might not feel like you're getting the same joint forces, but you're still getting a lot of benefits. Some of the other benefits of water: strength, agility, cardiovascular function. So when you're in the water, your heart is pumping more efficiently, and this is really great for our overall cardiovascular health. You're also challenging your lungs to breathe against that hydrostatic pressure pushing back against you. Pain is probably our one of our second biggest benefits of water, right? We can do more physically in the water often than we can on land. And that is a wonderful way to get the benefits of exercise without the side effect of pain. Improved flexibility, especially if you're in that warm water pool. Your muscles can lengthen with more ease. You feel less pain, so you might be able to push a little further. It's a wonderful relaxation property as well, which feeds into the next point: muscle tone and spasms. And with this, I'm thinking more about our neurological population. So that relaxation from the input of the water is very helpful for decreasing spasticity, particularly in the lower limbs and upper limbs, for some of our neurological populations, such as a post-stroke. Last but not least, balance and edema. So balance, the water is a wonderful place to practice your balance training. And if you've ever had a fall and a PT is asking you to do balance exercises on land, you instantly have this fear, and it's a normal fear, right? Once you had a fall, you don't want to fall again. But when you're in the water, let's say we're chest depth water, and we're asking you to stand on one foot, there's not as much fear around doing that exercise, because worst case scenario, your hair gets a little wet, you get a little splish splash, and we try again, right? So it's a nice window to challenge yourself outside of your normal capabilities, right? You have more leeway to move and practice your balance than you might on land. And reduced edema, we kind of touched on this in the last slide. That pressure, really helpful for pumping fluid back up towards your heart. Very beneficial in our populations with lymphedema as well. So before we go any further, I want to make an important point about what physical therapy or occupational therapy, even speech therapy. I can't speak much to speech therapy, but I've seen some of our speech therapists treat in the water utilizing those unique properties. That in physical therapy, we are addressing a specific medical need and or functional limitation. So we're all this to nicely say we're not just in the water to teach you how to swim. If that's what you're looking for, there are so many wonderful local learn to swim programs that you can certainly find in your area, but we're here to address specific medical needs. And those needs might include some of them that are on this list. I try to pick just the most common diagnoses that we see in orthopedics. This is by no means an inclusive list. I could have done a whole presentation on just orthopedics, but I wanted to kind of dabble as an intro into everything. So arthritis and joint pains, and biggest, most common referral is for arthritis, and that can be of any body part, most commonly the low back, hip, and knees. And there's lots of good research to support it, particularly for the knees. Studies have found that exercising in the water is A, more comfortable, B, you have more strength gains, similar or sometimes even better than what you can find on land. And your gait training or your walking ability can also be easily addressed in the water. This kind of is pretty similar to joint replacements. When we look at the research for hip and knee replacements, there's lots of good research to show if you are in the water after your hip or knee replacement, you can see just as much or better benefit in your pain outcomes, your knee strength, your hip strength, your walking abilities, and functional things like being able to climb the stairs again. And there's a little bit of a gray area around when you can get back in the water after a hip or knee replacement. It's highly dependent on your surgeon and what their protocols say. But some of the new research coming out says 6 days after your knee replacement is the best time to get in and start early rehab. But this is obviously with a waterproof dressing over your knee. We don't want any open wounds in the pool. And then for hip replacements, 14 days is what our research is indicating right now. So that's a pretty exciting population to work with, because you can rapidly see improvements in that hip and knee strength with the water that sometimes you can't get on land because it's just so painful. Other post-operative conditions, back surgeries, shoulder surgeries, all of these things can be addressed in the water as well. Muscle weakness, kind of a catch-all, right? We have muscle weakness for a number of reasons, but we can really increase our weight bearing in the pool, sometimes much sooner than we might be able to, actually kind of circling back to post-operatively. So if we think about a post-op Achilles tendon repair, sometimes you have weight bearing restrictions. You're not allowed to put any weight through that foot for several weeks, but that limits what you can do on land, right? Strengthening wise, aerobic capacity wise. And if you're a young athlete and you're looking to get back to things, then the pool can be a unique place for you to work on your leg strength within your post-operative guidelines and make quicker gains than you could if you were just on land. So switching gears to cardiopulmonary, I just wanted to touch on the fact that there is research to support aquatic exercise for those with COPD, after heart attacks, chronic heart failure, or with POTS. Now, there's some limitations around when it's safe to be in the water with certain cardiopulmonary conditions because of the fact that the water does change the way that your heart and lungs work. And it does increase your cardiac output, which oftentimes is very good for rehab purposes. But if you are in later stages of chronic heart failure, or you recently had a heart attack within the last 6 weeks, then it might not be a safe environment for you to exercise. And as always, talk to your doctor first. And with POTS, The water is a safe environment for them to exercise because it gives you that support for your heart and keeps the blood pressure in a safe range, and they can just do so much more in the water than they can do on land oftentimes. Switching gears to neurological conditions, again, not an all-inclusive list at all. There are so many more things here, but the most common ones that our therapists see in the pool here is stroke, Parkinson's, MS, spinal cord injuries, balance deficits for a number of reasons, and muscle weakness again. And the pool, again, can be used in a number of ways to challenge your balance, decrease spasticity, increase that weight bearing, and get some more reciprocal movements. And then if we think about our young children, our pediatric population, they can see just about anything in the pool, and the kids really, really seem to have fun when they're there in the water and they're sneaking in some exercise at the same time. But most commonly, our pediatric therapists here are seeing patients with CP, SMA, gait abnormalities, muscular dystrophy, and low muscle tone patients. So when you're here in the water for physical therapy, what are our goals? These are the things that we're working on, and they're all based on our land function. So as much as we'd love to stay in the water all the time, we do live our lives on land, and we have to do exercises that have good outcomes on land. So we're trying to focus on gait training and muscle facilitation to improve our dynamic balance and help with our joint proprioception. Those are just a few examples of what we might be doing in the water. So I also want to touch on a couple myths because, and I could have made probably a whole presentation on just the myths about aquatic therapy. But I've often heard, well, the pool is just for people who can't walk well. And that's just not true, because you just saw a gazillion reasons for why the pool can be beneficial for young athletes to our older adults who are coming back off of a knee replacement, right? There's so many needs there. And I hope that you can be inspired to find something today. So number one, aquatic exercise does not have a benefit for those with osteoporosis. And that is false. So we looked at that diagram earlier of how much weight bearing we have. And if we think about our postmenopausal women, you've been told to take your vitamin D, you've been told to do weight bearing and resistance training. And although, yes, on land is likely superior, you're not losing out on those benefits by exercising in the water. There are studies to show, I only listed one here, that you can get just as much bone density benefits from resistance training in the water. The trick is that you have to be moving in the water. So we can't just float around in our noodles. We have to really get moving in the water. So fast-paced walking, you can even jump a little bit in the water, and those things will give you the resistance training and the weight bearing through your joints that are necessary to maintain that bone density and decrease the risk of osteoporosis. Second, thinking about our neurological population, patients with MS can never tolerate warm water pools, and that is false. Although sometimes, yes, warm water can be a trigger and it can be very uncomfortable, it can be managed. And it depends on the temperature of the pool, right? Most warm water therapy pools are at least 90 degrees. And so if we take breaks regularly, if we monitor how much we're in deep water versus more shallow water, we can certainly manage this, and the pool can be a wonderful place for our patients with MS. So don't rule it out. And lastly, aquatic exercise is just as good as land-based exercise. And that is true. We already touched on this a little bit, but there's studies out there that show there's equal benefit, and in some cases even more benefit, to aquatic exercise versus our typical land-based exercise programs. The challenging thing here is that we know the pool is wonderful. We know the pool has a lot of benefits, but pools are hard to find. A lot of our patients, across the board have difficulty getting into a pool regularly. and having access to a pool. They're hard to find and sometimes financially unattainable. So I think that the pool is widely underused simply because if you can't use it on your own, then it can be hard to carry forward. So let's talk about safety. Things to think about before you get in the water. We're going to use a stoplight system here. So our red stoplight items would be any sort of illness or infection, right? If you got that fever, it's best to stay out of the pool. If you're having any fecal incontinence, it's definitely got to stay out of the pool. The CDC actually recommends at least 2 weeks after your last incidence. Cardiopulmonary conditions are a bit of an asterisk because some are okay, like we talked about earlier. If you maybe had a heart attack last year, then it could be okay, but not if you've had one within the last 6 weeks, and not if you are in those later stages of chronic heart failure, meaning stage 3 or stage 4. If you have very high blood pressure, maybe you forgot to take your blood pressure medications and it's really high that morning, just like any type of exercise, it's not safe to exercise with very high blood pressure or very low blood pressure on the opposite end of the spectrum, any difficulties breathing, things like that. When in doubt, always talk with your doctor first. And then last but not least, thunderstorms. You don't want to be in the water when there's lightning in the area. Better to stay safe on land. Our yellow light topics are, again, they're a bit of a yellow, right? You can exercise in the water with these things, but there are some special considerations. So for seizures, it's okay if you have controlled seizures, you have a safety plan, and maybe you have someone with you. But if you have uncontrolled seizures and your medical team is still trying to adjust medications, it's best to stay out of the water for now. Pregnancy is actually typically recommended for our women with that low back pain that comes during pregnancy, but considerations are you don't want to overheat, you can't overexert, and if you're a high-risk pregnancy, it's recommended to chat with your doctor first. Broken skin, open wounds, make sure they're covered with a waterproof bandage prior to getting in, and this is because there's an infection risk, right, for you and for others in the pool. If you are a patient with diabetes, we always recommend that you are checking your blood sugar, you got your snacks on the pool deck, and that you are checking the bottom of your feet after exercising because your skin gets gets nice and soft and it's easily tearable, and we don't want to develop any open wounds that could be slow healing or cause infection. If you use oxygen, you can still exercise in the pool, but you just want to make sure you have a plan for where that tank is going to be, if it can or cannot get wet, and make sure you have kind of safety plan around that. Bladder incontinence, we recommend that you have some sort of swim diaper on so that you're keeping the water clean. And then if you have that swim diaper on, that would be one of our green items. So these are the green go items are just kind of a checklist of you have your snacks, you have your water shoes to keep your feet safe, you have your water bottle because you will get dehydrated in the pool. As much as it feels nice and you feel like you might not be working that hard, you actually are. I've had many patients come back to their second aquatic therapy session and say, oh my gosh, I was way more sore than I thought I was going to be. I didn't think we did that much work. You were right, I was sore. And so I definitely recommend that you hydrate beforehand. Make sure you've had a good breakfast before you hop in. And then apply that waterproof dressing if you have any open wounds. Have your safety plan. Have a swim buddy. You should never be in the water alone. Yeah. And hydrate, yes, especially if you're in North Carolina and the heat index is like 105, you should be drinking water all the time, even if you don't feel like you need it. Okay, let's jump into the exciting stuff. So here I have a couple of videos of common lower body exercises, and these are kind of more of the basic level exercises. I'm not using any equipment here. I'm just doing some sidestepping, and then I'm going to add sidestepping with a little bit of mini squat. This is good for our lower body strength, right? Particularly those outer hips. I could have added like paddles to my hand to get more kind of total body integration. And I'm going to show a couple pictures of the paddles later. You can do backwards walking. This is something that most people would never attempt on land, but walking backwards in the water is easier than you think. And you could always, if you're not comfortable moving away from the wall, you could always walk next to the wall, have a little something to hold on to, or have a noodle in front of you to hold on to too, to help with a little bit of balance support. This tiny marching that I'm doing is good for a little balance, a little hip strengthening. And then we could also do some standing hip strengthening. We're looking at the second video now where we're kicking out to the side, outer hip strength there, and a little bit of balance since I'm not holding on to anything, but you could easily hold on to the wall. My imaginary wall is right there next to me. And then you can do your anterior and posterior hip, that front and that back, right? Getting all of those hip muscles. Quick shout out to my underwater videographer. It was much harder to get these videos than it looks. So thank you to her. I appreciate her very much. Here is another view of the forward and backwards kicks. And then the marching again. So this is now just stationary marching. You could do this at any pace. You could kind of hold on one foot, get a little balance going. You could combine those movements. So here's a little hip flexion with hip abduction with the knee bent. So you're getting a little extra resistance there. And then we can move into kind of some more global strength training exercises. This is a squat, and you can do this at any depth, right? Make it easier or harder depending on where you are in the water. You can do calf raises. Again, this is kind of a good ankle strengthening or balance strengthening exercise, since oftentimes when we are thinking about balance, we are thinking about balance strategies. And the ankle is oftentimes one of the first things to respond when we try to keep our balance. The last thing I was doing there was a little knee bend, but then here's kind of the fast-paced motion. So if you want to get more of that cardiovascular training, you can do the running in place with the knee kicks, the jumping jacks. You can hold paddles while you do this one too. You can run in place. You could run and move with this. Again, it has decreased joint. You can run in circles, throw your hands in the air. You can have a lot of fun with aquatic exercise. A couple still photos here of common pool exercise or pool noodle exercises. So even just standing on the noodle and trying to balance in place is a nice challenge. The middle one is walking forwards on the noodles. You don't see a video of me doing this because it is quite hard. And I have short legs, so the noodles make it very challenging for me. But I encourage you, if you're looking for a challenge, to try that one. And then you could even do planks in the water. If you have like a bench or seated surface in the water that's more stable, that would be a great place to start. But if you do the plank on the noodle, you'll get a lot of core integration, which is great when we think about our low back pain and prevention of back injuries. And one last video for our noodle exercises. I love this one. Leg press on the noodle is a good single leg strengthening exercise. I commonly would do this in more shallow water though, it'd be a little easier. But then switching gears to deep water. So here I'm in the corner of our deep well with a noodle wrapped behind my back for a little bit of support. And we're doing some of the same exercises you saw earlier, right? Leg kicks to the side, leg kicks forward and back, getting that overall hip strength. But when we're in the deep well, there's more core integration happening. You're having to really stabilize yourself and keep yourself from kicking up to the surface of the water. You'll also notice that I have ankle weights on here. And the ankle weights in the deep end give you lots of joint distraction, which is particularly beneficial for low back pain, especially low back pain that stems from arthritis, because it just takes that pressure away. Speaking of core integration, this is a bonus core exercise, a little bit of an oblique twist going on there. And the ankle weights here actually make it a lot more challenging than it looks. But you can also wear ankle weights while you're walking in the water, and that helps you really know where your legs are while you're moving. So for our neurological population, it's particularly beneficial because if you have low tone or inability to really move that leg like you want to, the ankle weights are actually way more helpful for keeping you stable in the water. Some stretches too, maybe you're looking for flexibility in your lower body. Here, I'm using the pool noodle to help me stretch my quadricep muscle, the front of my thigh. And then here I'm using the pool wall to help stretch out my hamstrings and calf. And you can do this in more shallow water. um, I'm on the shorter end, so I need to be in about 3 feet of water to do this appropriately. Go. Last but not least, for intervention ideas, I wanted to mention Chi because it's a pretty popular exercise program that you might find in some of your local pools. Maybe it's a group fitness class that's offered at your facility. So Chi is wonderful for working on relaxation and really incorporating your breathing. It's very like slow moving. And sometimes we can use it clinically to address muscle tightness and pain and breathing. So for some of our cardiopulmonary patients, we love to use this to emphasize kind of breathing in as you open and exhaling as you close. But I definitely recommend those classes if you have one available to you. And then as we start to wrap up here, just a couple fun additions. So if you have kids in the pool with you this summer, maybe it's your own kids or grandkids or nieces and nephews, our pediatric therapists recommend it. Just a couple fun things that are not necessarily skilled interventions, but just fun things to do in the pool. And of course, safety first. Make sure they are safe and near the wall and can float, but encourage moving those legs, getting that kicking going or blowing bubbles and even exercising together. So if you wanted to challenge your balance, maybe you are standing on one foot or standing one foot in front of the other, and the 10-year-old child is, jumping around you and making some turbulence or making some waves and kind of making you keep your balance a little bit more like you're in the ocean. Or maybe you have a beach volleyball around and you can toss that back and forth as you do some of your exercises. That's some of our favorite things to do with kids. And these are a couple of the things that you might find on your pool deck. So those hand paddles that I talked about give you more resistance as you're moving through the water, or the ones that are more buoyant and floaty. Some of them are harder than they look, so choose appropriately. Like the white ones are a little bit more challenging than the blue ones pictured here. They also come in like a long barbell version, and that's really good for some core integration as well. You can kind of use them like noodles. And then if you are in the deep end and you're like, Jolene, putting that noodle under my shoulders is not a good idea. It really, really bothers my shoulders. Then you can maybe look at a buoyant belt. There's different types. The one that's on the far right, it's a little thicker. That one gives you a little bit more support for your low back and sometimes is a little more comfortable. But you can use those in the deep end instead of a noodle. So as we wrap up, just a couple pictures of the pools that we use here at UNC for aquatic physical therapy. There's one here at Meadowmont where I am today, and another one in Northwest Cary. And if you're not in North Carolina and you're looking for more information, our national association, the American Physical Therapy Association, has a great website called Choose PT with lots of information about like the top 10 exercises you can do in the water and more information there. And then the Academy of Aquatic Physical Therapy is another great resource. They have good fact sheets about different types of patient populations and also some links to find a PT in your area, wherever you are. A couple of references that I talked about today. And now I think we will wrap it up and leave some time for questions if there was anything that came up. I know I talked really fast. I was trying to get through it so that I could hop back in the pool this afternoon.
Jolene, that was great. Thank you so much. I'm just kind of looking at the chat here. If anybody does have any questions, please feel free to put them in that chat. While I give you a chance to do that, I would just want to just kind of tack on just a little bit to say that, I'm here at the Northwest Cary Wellness Center. And when we have patients come in for physical therapy, for aquatic therapy, so first of all, within the state of North Carolina and in most states, for most insurances, with the exception of Medicare, you do not need a referral to come in for physical therapy. So if you have something that is more orthopedically based and you want to come in for physical therapy, we are direct access providers and you can come directly in. If you are Medicare, you do need a referral, but if you have a relationship with your primary care physician, you can just give them a call and say, hey, I have this going on, I'd like to do PT, and they can put that referral in for you. You don't need a full visit there. Now, as far as aquatics are concerned, I just want to make sure how we do it here is that the very first visit you would come in, we would do a land assessment first. Right, so you would not get in the pool the very first day. No need to bring your bathing suit. You would come here. We're gonna take some tests and measures and kind of see what's going on. Come up with our working diagnoses. Kind of see what your impairments are, and then tailor your program to that. So, assuming that aquatics might be part of that, we will plan for the future for future visits to be in the pool, and we'll kind of go. We'll discuss that before you actually get into the pool. And then depending on your level of need, the therapist can either be just on the pool deck to work with you and help direct you through the exercises. But if you're in a place where you need assistance in the water, we do have therapists that spend half their day just in the pool. So they do not come back into our gym clinic. They'll just stay at the pool all day so they can get in and out of the water and help you out as needed.
Thank you, Evan. That's a really, really important point because, again, all of our goals in physical therapy, whether we're on land or in the pool, are land-based, right? We are looking to improve those functional limitations or deficits. So it's very important that we see you on land first so we know what to address and why, and then we can develop a good individual program for you in the pool, with possibly a transition back to land only. That's also an important point to note. But it's all done on an individual basis. Thanks for bringing that up.
Yeah, I always like to remind my patients if I send them for aquatic therapy or if I go to the pool with them that we are not fish. We need to get back on the land somehow. So it's important to kind of close that loop a little bit. While we're kind of waiting for anybody to put any questions in the chat, I am going to go put in the chat again those links so you can see our Therapy Thursday YouTube page, our YouTube channel. So go ahead and subscribe to that and it'll let you know when we have new videos available. And then also our Facebook page where you'll find out about other events, not just Therapy Thursdays. So I do invite you to please go ahead and like and subscribe on our social media sites. And with that, we're going to continue to open it up for questions. Now would be the time. Going once. Going twice. All right, we're going to go close it on up then. Jolene, thank you so much for your presentation today. Even as a clinician, I learned a lot about our patients getting in the water, so I thank you for that. I hope everybody kind of got something out of the presentation today, and do please come back and keep an eye out for other Therapy Thursday presentations. That's it for today. Have a wonderful weekend, and we'll see you next time.
Thank you so much.